So here at the Medical Legal Partnership, I wanted to highlight that what we did at Centura was, again, I always have to align it with the mission, vision, and values. And the mission at Centura Health is to extend the healing ministry of Christ by caring for those who are ill and by nurturing the health of the people in our communities. You can read both theological and social importance into that. There's a requirement that we live up to nurturing the health of the people in the communities we serve. And I'll tell you, when I first came to Centura and I started talking about the health and the community, they said, well, that's not our mission. What are you talking about? And at times, faith-based entities can see their mission solely in the area of the faith component, spiritual care, how we treat each other and the like. And my argument was that we are not living up to the full mission, which requires both a inside and outside approach. So we feel like there was great alignment between the Centura Health mission, the National Center for Medical Legal Partnership mission, and we thought also that even the American Bar Association mission had some alignment. So we put all three of those together and had the conversation, and we're able to start it. Again, it's only been under a year. My first move was to hire Carl Patton, recruited him after, I think, 8 years down in Florida at a Florida Blue, and we got started. So how did it look? It was important to go beyond the mission. It was important to align it with the organization's vision and values. It was important to show a value proposition. And I had had success already with the community health worker program, so I was able to say, if you believe in me, here's a rough sketch of what the value is going to look like, but it's going to take some time for us to figure it out. Allow me to hire an individual, which they did. I'm on the inside. You're not going to make that claim on the outside. It's not going to go well, right? You're going to need a little more data and rigor. We're going to talk about what that means. I was able to show a potential return on investment. We wanted to make sure that we saw MLP as part and parcel of the move towards value. And when I say that is it's a stepping stone, it's a building block to support us to getting ready and being willing to think that we can move into this value space without losing our shirt. Because as you saw, there's some up and downside risk. So Centura's vision of MLP is that we want to use those legal levers to impact the social determinants of health. We wanted to improve the patient experience. We wanted to lead in some respects in developing the capacity for value-based healthcare, particularly the issues associated outside of the narrow notion of medicine. And we wanted to see cases that we saw as canaries in the coal mine, those individual cases that we're starting to see. They trigger us to think and look a little bit more deeply and to see if we're at the beginning of something that's going to be coming down the pike in more advanced ways. And obviously, it's an opportunity to think about policy issues and community issues as well. So when we thought about ours, and we all know there's different ways to do it. So in Massachusetts, we worked closely with the legal aid when we set it up there. In Colorado, we are using both the academic, so we're working with the law schools, we're using pro bono attorneys, and we're using legal aid. So we just married three together, and depending on the issue, we triage it and we send it to the appropriate partner. And when we started on cases, when we kicked this off, and I can't state this importantly enough, if you're working on a pilot with a health system, try to get it in 2 different locations. Oftentimes, if you get it in one location, you'll run into cultural issues, and it's not the program, it's the culture of that organization that defuncts the whole thing, and I think that that's a challenge. So when I did it in Massachusetts, we started in 2 locations. We started down in Fall River and also in Brockton, and then when we're doing it now in Colorado, we're doing it back in Pueblo and in Denver. And we're studying both cases. And there's a health delivery science that us hospital execs haven't figured out yet. And there's money in that space, by the way, for those of you who are interested. NIH with the pragmatic trials, Patient-Centered Outcomes Research Institute. So we knew that we had to try different approaches in different locations. We like to say we have a bottoms-up approach and a top-down approach. Top-down, get the data, quantitative data. What does the system tell us is a potential opportunity? But then get out in the community, get to the nurses, get to the social workers, think qualitative data. What else do they know that the data's not telling us? So it's got to be a dialectic between both sides. And then when you start pitching to pampered executives, I think there's 3 things you need to remember. 1, be tenacious, don't give up. If one door closes, another one opens. If there's multiple SVPs, just because one said no, doesn't mean another one's not going to say yes. And be chameleon-like. So if you're going to talk to a guy like me, you can talk one way. If you're going to talk to a CFO, you better not have the same conversation. I also think you have to speak to the myopic interests of the individual executive you're meeting with. So if somebody's involved in strategy, know that strategy well, and go there and speak on their terms. I can't state that enough. Executives at the table are not always on the same page. In fact, they're often at opposition with each other. another story. And I love telling stories because I think that those are always more memorable than the words in the slides. So my story is that when I first started in some of these roles in Mercy Hospital, Portland, Maine, there was a fellow executive there, and unbeknownst to me, I'm like, hey, we're here to help people, right? Let's do it. And he had different visions. So we had met before a presentation to all the executives, and I had one idea, and he said, no, I think you should do this, and you're going to create this kind of new model where folks are in competition with each other and it could lead the whole organization. And I scratched my head saying, so we're going to compete against each other in the organization? How does that make sense? But he was senior to me, so I go into the presentation and I pitch what he suggested. And the first comment was from him, and I'm smiling like, wow, I got my support. And he says, I think that's a horrible idea. He said, I think this competition thing doesn't make a lot of sense, and it's going to completely make the whole program fail. That was a painful experience for me, I'll have to admit that. I went home that night, and I remember this feeling that I hadn't felt before and I haven't felt since, where I felt like there was a piano on my neck, and I didn't sleep much that night, and it was stress, apparently. But I say that because it hurt, and it's important to recognize that and to remember what those experiences do for you in your life. But I also say that as an example of what you encounter at the highest levels of organizations. And I say that it's a challenge, and there's a patient in the middle, there's a community in the middle, and we've got to do something about the pampered, and I'll say it, overpaid healthcare executives, because it's getting in the way of us having the kind of social justice ethos that I believe is part and parcel of community and population health. Last slide, the last bullet I'll highlight there is keep in mind the interest of the mega health system in the background, right? So you're pitching that individual hospital potentially, you're pitching that individual executive, but understand if they're part of a mega system, understand what that mega system is thinking in the background, and speak to that, right? And they'll be impressed by that you're speaking to them, but also to these broader interests. So do your homework aggressively as you pitch the pampered execs. So when we think of the value of MLP, we think of it from a patient perspective, we think of it from the community perspective, and we also think of it from the health system perspective. So we want to improve the experience of care for patients. In the community, we want to respond to gaps, particularly gaps in social services and public health service systems. And at the health system level, we want to figure out how to either reduce costs or increase revenue. That's one of my most valuable lessons I learned from my for-profit buddies in healthcare. They said, hey, Mr. Community, if you're going to survive here, you're going to do one of two things. You're either going to bring us revenue, or you're going to do some cost reduction, or you're going to be a reduction. And that's a quote. So it's a very powerful message when you're forced up against it, right? It's fight or flight. And you can win, but you have to understand what's at stake.